What's going on, folks? Welcome to Kids Today with Dr. Kamal Jones. I am Dr. Kamal Jones. On today's episode, we are breaking down the new lawsuit from the American Academy of Pediatrics and several other leading medical groups who have sued RFK Jr. for his decision that he has made around the COVID-19 vaccine. As always, definitely like the show. Make sure to subscribe to the channel and follow us on Spotify if you're not already following to this point. So this is fresh off the press. On Monday, July 7th, the American Academy of Pediatrics, in addition to several other leading medical organizations, have sued RFK Jr. for his essentially unilateral decision to remove COVID-19 vaccination from the vaccine schedule for children and for pregnant people. This is a big deal, mostly because of how he went about it. So I actually read through the 42-page lawsuit so that you don't have to. And let me break it down for you. Essentially, what the lawsuit did was it listed a host of really important background details, things like RFK Jr.'s background and history as far as vaccines, things like the overall history of vaccination in our country, talked about many of the promises that were made by RFK Jr. during his Senate confirmation hearing and in the weeks even leading up to his decision to remove COVID-19 from the vaccine schedule. And it essentially laid out the case for why his decision that was made was done from really an ideological standpoint, more so than from any scientific standpoint. For me, the big takeaway when I review this lawsuit that has come from, again, the American Academy of Pediatrics and several other leading health organizations, the main takeaway for me is this. It is less important about, in this particular case, whether or not you actually personally agree with COVID-19 vaccination. It is less about whether you think the science supports or doesn't support the COVID-19 vaccination being for children or for pregnant people or not. It's clear that the American Academy of Pediatrics does support that, and that these other organizations who are suing do support that. But that's not really what this is about. This lawsuit at its core is about process. It is about, are we okay with, as a country, having one individual and a couple of the folks that he brought along make a decision to remove a vaccine from our regular schedule, from the schedule that determines whether insurances are covering vaccination, from the schedule that determines whether or not clinics and hospitals are offering this vaccine to its patients? Or do we believe that the correct way, the scientific way, is to have our committee in place with nonpartisan folks who are approaching this from a scientific standpoint and are making decisions that are not about what their beliefs are or about what their preconceived notions are, but about what does the evidence actually point towards? What does the evidence actually tell us is the safe and effective thing to do in each particular and individual case? And so the crux of the lawsuit is that the unilateral approach that was taken by RFK Jr. was not legal. This is what it says, and I'll read this to you. Quote, "The secretary failed to explain why he ignored and bypassed without explanation the long-standing, well-accepted, science and evidence-based ACIP process for developing recommendations for the CDC immunization schedules that stakeholders across the country have relied upon for years." That's what we're talking about here. We're talking about a failure to move through the process in the way that we have for years, and a lack of explanation for why that took place. Right? There are times where the process has to be altered because of an emergency situation or because of some mitigating circumstance, and we're mature enough to have that discussion and conversation. We're not stuck to some singular path. But if you are not going to go through the official process, then there needs to be an explanation, because physicians all throughout the country, families, children, all throughout the country are relying on accurate and science-based processes as decisions are being made about health and well-being. When I think about what is happening in my clinic, I want to know, as other pediatricians want to know throughout the country, that what is offered to me as far as a vaccination schedule is one that has been reviewed thoroughly by our top scientific minds, not a decision that came from on high from one individual who has a law degree and no particular health training or background, who has decided that he was just going to pluck something out of availability or put something, for that matter, onto the schedule for children or for pregnant women. So we need a process in place, and we have had that up until this point. So if they win this lawsuit, the goal for the AAP and for these other health organizations is for a judge to reverse this decision made by RFK Jr. and to essentially re-add COVID-19 vaccination back to the immunization schedule. I think the even more important overarching goal is to force them to use the actual process when making decisions about the immunizations that will be offered to our nation moving forward. On a personal note, I am really happy to see the American Academy of Pediatrics moving in this way to maximize its strength in standing up for children and for families in this moment. We've seen the American Academy of Pediatrics standing up on a number of occasions over the course of its history, but especially over these last several months. But this is a really powerful step to say that we're not just going to put out statements. We're not just going to advocate, for changes in laws, that we're going to pull every single lever that exists on behalf of children and families to fight as hard as possible to make the change that is necessary. That we will not leave any stone unturned when it comes to standing up for children and families. And I think that is a powerful message to send, not just to the children and families that you care for, but also to the pediatricians that you represent and to doctors all over the country, that we not only don't accept this, but that we're willing to fight for it and that we're willing to put some skin in the game in the process. So, hats off to the American Academy of Pediatrics and to all of the organizations who have taken the risk in putting this lawsuit on the table. Okay, my friends, that is our show today. Thank you so much for tuning in to Kids Today. As always, please make sure to like the episode, subscribe to the channel if you're not subscribed, and leave a comment. Let me know what your thoughts are about the process of really approving vaccines in a way that is safe and effective. Do you think it's okay that RFK Jr. decided to do this essentially unilaterally? Do you feel like we need a strong scientific process in place? What are your thoughts? Definitely leave a comment below. And until next time, this is Kids Today.